Joining us this morning is Dr. Farida Briani, a surgical oncologist from the MMC Hospital in Jakarta. Good morning, Dr. Farida. Thank you so much for joining us.
Morning. How are you?
Good, thank you. So we have so many questions around this condition, doctor. So what are the early signs of breast cancer, and what are the steps that we can make to combat the condition?
Okay, so signs of breast cancer actually can be variety signs, can be like lump in breast, change of the breast skin that becomes like orange skin or bloody nipple discharge. But when you ask me about early signs of breast cancer, I think we should know how to do early detection of breast cancer, because that's the most important issue actually. So in order to practice breast cancer early detection, the best answer is to raise awareness of all women and men to do breast screening. Rather than telling them, if you feel this or that, go see the doctor, better telling them that it is very, very important to check their breast or doing screening regularly once every year. Why is that? Because early stage of breast cancer can be unpalpable, so you cannot even, put a sign on it. Also, it probably won't give any sign like pain or any changes that can easily be seen. So let us agree about what is important to be told to people about breast cancer is, please do routine breast screening. Start by doing breast self-examination at home once every month, and also visiting doctors to do clinical breast examination once a year. I think that's the most important message that we have to spread to all community.
You also mentioned not only women, but also men. This is the first time I hear that men can actually get breast cancer. Could you please explain to us the condition, like breast cancer, men experiencing breast cancer? Is that possible?
Yeah, because actually men has breast. Because we all human have breast, but there is only 1% for cases of breast cancer that men have. So actually, men have a very low risk of breast cancer because they don't have periodical hormonal situation like women. Like we all have periodical every month, hormonal periodic. Men don't have it. So that's why the risk of men of getting breast cancer is actually quite low, only 1%.
Okay, but what are some of the causes for breast cancer? I mean, if we knew the cause, perhaps we might be able to help with prevention, right, Doc?
Yeah, well, what causes cancer is actually the mutation of gene that cause the cell division is like disrupted.
Okay.
And what cause the mutation of genes is very abundant possibility. So especially for breast cancer, if you're talking about another cancer, there are some virus that can cause it, like cervical cancer caused by HPV, human papilloma virus, but not for breast cancer. There are so many probability of causes that someone can get mutation in their genes, and then that cause the mutation of the cells. But please do not misunderstand or do not mix the understanding between genetic causal and also the inherited disease. Because when we talk about like genetic, so people usually suddenly think, oh, it's inherited. So if we talk about inherited causal, that means that it's in your blood, in our family blood. Okay. But if you talk about genetic disease, it means that caused by the mutation of the genes.
Right.
So like usually people said that, oh, I don't need to do breast screening because there is no history of breast cancer in my family. But people have, that's really common.
Yes.
But people have to understand that from all cases of breast cancer that is caused by inherited is only 10%. So inherited breast cancer is only 10%. The rest of it, 90%, are just sporadic. Means that anyone without any history in the family can get breast cancer. So that's why, again, screening is really important, especially for women above 40 years old, because start from 40 years old, actually the risk of women to get breast cancer start to raise, and it will be higher and higher while we are getting older. So it's also like misunderstand in the people, everywhere said that, oh, I'm already old, doc. I don't need to check anymore my breast. Or I already got menopause, so no need to check my breast. Well, it is wrong because the older the women, so the higher the risk she has to get
Right.
breast cancer.
So, for
That's the
example,
most important message, I think.
yes,
Yeah?
thank you so much, Dr. Farida. I also hear mixed messages about the kind of diet that you should have if you're a cancer patient. Some of them say, oh, I should avoid eating meat now, red meat or any kind of meat.
Yeah.
I should go plant-based. But some other would say, actually, it really depends because your body is different from one another. If you're a cancer patient, then, you can still consume meat. So could you please clarify this for us, doctor? What kind of lifestyle should a cancer patient have or adopt in order to, have a longer life?
Yeah. Well, in our guidelines, there is no such food that we can call as miracle food that can protect you from cancer, or one bad food as long as it's natural, okay, that can cause cancer or can cause the cancer to recur. So for survivors, because you asked about people not to
Yeah.
get cancer anymore, so for survivors, actually what we will suggest to them is just balanced diet. Balanced diet means that you may eat anything, but just for your need. Like you still may eat red meat, but research shows that eating red meat like 65 grams per day or like 130 grams 3 times a week is okay. It's not it won't cause anything bad on you. As well as like people talk, don't eat sugar, don't eat soy, which is if you eat all of them in the just enough amount that your body needs, just moderate intake will be enough. And in fact, like soy actually some new research found that it can protect the breast cancer recur, or in healthy humans it can prevent you from getting breast cancer, especially if you are starting the diet with soy, but again in the normal amount, moderate amount, since you are pre-puberty. So there are some research that is quite strong about it. So, but what I want to conclude is like, if I am asking by my patient what should they do for their diet, I will just say, just eat regularly. Don't think too much about what you have to eat. Just try to eat healthy food, balanced diet, and also
Yeah, and I think
and
that-
also try.
Yes?
Go ahead, Doc.
Hello.
Go ahead, Doc.
Yeah, and also try to get another healthy lifestyle, not only food, right? Because
Yeah.
our people keep thinking that food is the most important factor, while they also need to know that there are other lifestyle that can help them to prevent from recurrence of cancer, like doing the exercise regularly, every day, like or 5 times in a week, and 30 minutes in a day, with moderate level exercise that can prevent them also to get the breast cancer to recur.
And resting as well. I think nobody ever kind of puts an emphasis on rest, and I think a lot of us are under-rested most of the time. We focus so much on exercise and diet that we don't think about the amount of hours that we sleep per night. And I think Doc brings up a great point. All those things that we mentioned about whether it's meat or sugar, I think it just overall applies to general health, right? Like if we follow moderation, apply moderation to anything that we put into our bodies, I think it'll be good for us in general as well. And I believe we have Weeby with us here as well, who's got some questions. Hey, Weeb.
Jumping into your conversation here. Hello, doctor. This is Weeby here. I have a few questions, myths and facts that many people think about when they're talking about breast cancer. Okay, let's go straight to it.
Yeah.
The first one: are tomatoes, beetroot, grapes, and sour soup good in killing cancer cells?
Yeah, so actually that we just mentioned, right? There is no such miracle food. So there is no strong scientific evidence that said those those food, if we consume in a very big amount, can prevent us from any cancer. No, so just eat moderately.
Myth.
Eat moderately and try to be varied.
Okay, I would have thought that was a myth as well. I haven't heard of any sort of thing that would have happened.
Okay, the next one, I'm gonna have to ask you guys for this one.
Okay.
Myth or fact, the use of deodorants boost developing breast cancer?
Ooh.
I hope not. Oh my God, James.
Uh-oh. I'm a regular user of deodorant.
Me too.
I'm going to say no. I'm going to say that's a myth. What about you?
All right, what is that?
I don't know. I would rather just hear what Dr. Farida
Right,
has
let's
to
hear it.
say.
Go ahead, Doc. Clear this up for us.
Is it true, doctor?
Yeah, well, because underarm antiperspirants or deodorants are applied near the breast and contain potentially harmful ingredients, several scientists and others have suggested a possible connection between their use and breast cancer.
Right.
However, no scientific evidence links the use of these products to the development of breast cancer. So,
Right.
no evidence
No
yet.
evidence yet, but it's just a theory.
Yeah.
Right.
Just use it in moderation. I think we'll be okay.
Yeah.
All right.
Instead of 3 strokes, just 1.
Yes. Right.
I got a next myth or fact. Maybe Marissa can answer this
Okay.
one. Can the use of overly tight bras, especially in sleeping, boost the chances of developing breast cancer?
I want to answer this one too, but you go ahead.
I would like to say yes because I like to be braless.
Right.
Yeah, I'm going to say yes as well because I've heard, and I don't know if it's true, that you shouldn't have any kind of a constriction while you sleep. So I don't know if that has anything to do with breast cancer, but I heard that's not good in general anyways.
Let's confirm
Let's
with
hear it
Dr.
from the doc.
Well, again, no evidence about it. But
Okay.
we certainly know that wearing tight clothes in long period of time is not good for our health.
Right.
Maybe the one get affected first is our skin, not breast. But yeah, there's no scientific evidence.
Okay.
Yay, more braless people.
It's uncomfortable anyway, right?
Okay, now I got a last myth or fact here for
Yeah.
you guys. Can radiation from the gadgets that you hold every single day affect breast cancer?
I'm going to answer this one first. I'm going to say fact because
Fact.
I don't know. I just heard a lot of chatter out there about, you know, different sorts of gadgets, and we have more and more gadgets around us every day. So I'm going to make an assumption that perhaps it's true over a long term. How about you?
Well, I would like to say it's true just because I want people to be less on their gadgets.
Good point.
Okay, doctor, how about it?
Well, actually, there is a study published in 2020 mentioned that excessive smartphone use significantly increased risk of getting breast cancer, particularly for
It's true.
participants with smartphone addiction, a close distance between the breast and the smartphone, and the habit of smartphone use before bedtime.
Right. What
Because,
is
you know,
what is a
like
close
teenagers,
distance?
yeah, keep using the. Well, it's not mentioned. It's not there is no like cut off distance, but
Right.
you know, like if you see the habit like teenagers, they usually going to bed with holding the the gadget and then keep playing around until they fall asleep without turning off
Oh, goodness.
the gadget.
Right.
So that's not really good.
And I would assume any handheld gadgets would be close
Yeah.
distance, right?
Right.
If, for example, if you were in front of a screen, like a
Yeah.
TV screen or anything, it'd be farther away. But if any sort of gadget you hold in your
Yeah.
hand would be right there, and the position is in line with your chest. So.
Right.
Maybe we
Correct,
should
correct.
consider charging our phones away from the bedroom.
Oh,
I mean,
I
it's
love
like, right?
Yeah,
You do
that's what
that.
I
I do that too. Do you do that too?
I'm
Nope.
guilty of this question right here.
Careful.
I do still do it sometimes, yes. I
Right.
have to admit
Yeah,
that.
maybe we should, create that distance now with our gadgets just to keep ourselves healthy.
Yeah, all
Is
right.
there any more myths and
That's all
facts
we
to be
got
busted?
for now.
I've got a question, Doc. I've got a question because this one kind of hits a bit close to home. I want to touch on breastfeeding women. When it
yes.
comes to breast cancer, does it have any adverse effect on milk production?
Well, actually, the one that we have to concern about is once a woman got diagnosed with breast cancer, then the proper treatment should start, right? And the treatment can be surgery or systemic therapy. Systemic therapy means that you use a medicine that flows to all around your body, so it can kill the cell cancers that flows in your like vascular. So once the women got the systemic therapy, actually she must not get or give breastfeed.
Okay.
She must not.
Makes
So
sense.
because the the medicine can affect the milk and it's not really safe for the baby.
Yeah, that makes
But
sense.
may I
Go ahead.
may I deliver one important message here, because there are so many patients in our clinic, sorry, comes with sign of breast cancer and it's quite late. And surprisingly, they said that they already got the signs actually when they were pregnant or when they still give breastfeeding. And they come to doctors. Some of them come to doctors, and some doctors said that, oh, you got relaxed, because we know if you have children and you breastfeed your children, then the risk of getting breast cancer is lower. So you got relaxed, just wait until you give a birth or you finish your breastfeeding, then check it. While this is actually not really right, because when a woman is pregnant or when a woman is giving breastfeeding, actually the breast cells is growing up quite fast. And actually at that period, the cell is more sensitive to get mutation.
Wow.
So it is right. Then when we have already delivered a birth, we will have lower risk of getting breast cancer 10 years after the first birth.
Okay.
But when we are pregnant or when we are breastfeeding, actually our risk is getting higher.
Okay.
So it is really important for women to understand that when they find any symptoms or any signs in their breast during that period, go check to the doctor. And if the answer is like what we just the one that I told before, just try to find second opinion or third opinion.
Okay.
Right.
So I think it's really important for us to empower the women, especially with the right information, so they can take care of themselves.
Well, that's great, Dr. Farida. I still have one more question.
Yeah, go ahead.
Guys, if that's okay. So the current examination process is through mammogram, right, doctor? That we women have to do once a year. Now, a lot of women, I'm not saying all, a lot of women are discouraged to do that because I heard, because I have never done it, doc, I'm not 40 yet, but soon I will be. I heard that it's painful. Is there any other way to examine whether your breast is healthy or not, other than pressing your breast on this, two pieces of thing, hard, it's not metal. Yeah.
Yeah. So mammograms is a screening method for women above 40, right?
Yeah.
And until now, the strongest study in the world still say that it is the only way if we want to lower the number of deaths in breast cancer in one community. So talking about it's really painful, I think it's actually very subjective because sometimes women just need courage from the doctor. Like I usually ask my patient, like, okay, when you were giving birth, was it really painful?
Good point.
Was it painful? Yeah, they said, yeah, it's quite painful. So I said, mammogram is like 1/1 million maybe of the pain of giving birth.
Good point, doc.
And or I tell them, okay, but if you still worry about it, we can just give you medicine. So usually we give them painkiller, like they have to consume it like 1 hour before mammogram. And there is a gel that consists of anesthetic gel actually that they can, apply
Numbing
on the breast, like half an hour. And yeah, that really lower the pain. And I keep telling them that this is really important for them to prevent them from the very serious disease.
It's better to have a little bit of
and
pain
one
now
thing-
than down the road. Right.
Right. Another thing. There is some women said that there is ABUS. Maybe you have ever heard about it, automatic breast ultrasound. Some hospital try to advertise them that it can replace mammogram, and it is not right. So women still have to do mammogram, but if they do mammogram plus ABUS, that will be the best. So I think that's what they have to know.
Great.
Wow.
Thank
Good
you
stuff,
so
Doc.
much.
Thank you so much for all that info. Really have dispelled a
You're
lot
very
of myths
welcome.
as well, because
Absolutely.
a lot of us hear a lot of things all the time, and glad that you're able to straighten out those facts as well for us.
Hope it's useful.
Okay, take care, Doc. We'll
Thank
talk to you
you.
soon. Stay healthy,
Thank
Doc.
you,
We'll talk
Dr.
to you soon.
Farida.
Bye-bye.
Thank you.
You too. Bye.
Awesome.